good night, good morning, good morning and good afternoon to everyone. Once again, it is with great pleasure that I meet you today for this new webinar. This time on hands rejuvenation with hyaluronic acid dermal fillers. We are extremely fortunate to have Dr. Fabio Fantozzi today with us. And on behalf of Bioscience, I would like to thank him for his kind participation. So today is the third episode of our the Aesthetics Code series, which is meeting with increasing success. There are more of you every episode, so thank you very much for that. Since we are confined to our own home, like everyone else, we are aware of the difficult situation you're going through, and it's a real privilege to share with you all our knowledge and experience on hyaluronic acid and dermal fillers. As you know, Bioscience has several brands of hyaluronic acid dermal fillers, and we are the only brand in the world to offer a complete range with different types of hyaluronic acid, monophasic in two compositions, monodensified and polydensified, for the face, and a unique biphasic formula for face and body. The most important thing, and we really care about it, is that thanks to the quality of our product and because we control the whole production process from A to Z, we are today the only manufacturer to make HA fillers with a CE mark for facial and body treatment. I leave the floor to Dr. Fabio Fantozzi, who will speak to us today about hands rejuvenation with hyaluronic acid. Just like the last time, during the presentation, we will allow you to ask questions in writing to the letterbox you see on the right side of your screen. We'll try to put together the repetitive questions in order to try to answer them all. We apologize if we cannot, because we always receive a lot of questions. Anyway, we will also probably keep some questions as presentation topics for the future webinars. Dr. Fabio Fantozzi, who, for those who don't know him, received his Doctor of Medicine degree from Rome's La Sapienza University. After he has completed his residency in general surgery at this university, Dr. Fantozzi finalized a plastic surgery residency with Professor Ivo Pitangui at Carlos Chagas University in Rio de Janeiro, Brazil. He published several studies in the European Journal of Plastic Surgery, especially an article about hands rejuvenation with grafting in July 2017. Dr. Fantozzi is also a board-certified plastic surgeon at the Brazilian Society of Plastic Surgeons. He is member of the directive board of Société Monégasque de Documentation et de Recherche en Chirurgie Plastique et Esthétique in Monaco. And he is president of ACIEIP, the European Association of Plastic Surgery. Last but not least, Fabio Fantozzi is a prestigious member of Bioscience Scientific Committee. Dr. Fantozzi, nothing else to say. It's your turn.
Okay, thank you, Matteo. Good afternoon, and I would like to thank all the Bioscience team. And we just arrived in the third step of our webinar. And so today we talk about the management for the hands rejuvenation with the dermal filler. And I am Dr. Fabio Fantozzi. I study in Brazil, and now I work in Italy. And today we talk about hands. And so in the human history, we have always been fascinated by the beauty of the hands. The hands represents the status of men. A farmer's hands are different than a surgeon's, for example. And with the hand, we can make real language. For example, I am Italian. We talk with the hands, and with the hands we can find in this moment. If you look at this painting of Michelangelo Buonarroti, that the creation of Adam is a painting of 500 years ago, that Michelangelo show in this painting there is Adam, that is the man, as not he created. He still appear in the material torpor, and the hand of Adam is abandoned is in contrast with the decisive and energetic creative hand of God. God transmitted life by the hands. We infuse the spiritual life to Adam. And we have the creation of Adam, and so the human. And so we talk today about the hand, and we compare the hand in the young hand with the elderly hand. We can see many differences. The aesthetic aspect of the young hand are we have good skin quality, absence of flaccidity, absence of alteration of cutaneous pigmentation, superficial veins and tendons on the dorsal are barely visible, and we have a good percentage of subcutaneous tissue. If we compare with the aspect of the elderly hand, we can see that we have a deterioration of skin quality, presence of skin flaccidity, alteration of cutaneous pigmentation, visible veins and tendons on the dorsal, and practically absence of subcutaneous fat tissue. If we analyze the anatomy of the hand, we can see that behind the skin we have a venous system immediately. The venous superficial system is represented from the finger, from the venous, the digital venous, and we arrive to the dorsal venous arch, and to arrive in the basilic vein in the cephalic vein. Under this superficial venous system, we have the extensor tendons, and behind of this one we have muscles, nerve, and artery. We in this moment is really important to understand why the dorsum of the hand has these changes in after time. Is often that in the office I have the patient that arrive in my office and say, "Oh doctor, okay, my body is not the best, but I don't like my hands, and so old." And so the people, and the woman particularly, doesn't like these veins so visible, and the tendons, extensor tendons, so visible. And so we see that what we see exactly, we see in the dorsum of the hand, the plexus, the dorsal of the venous, and the metacarpal veins. And we see very well after the time the tendons, extensor tendons too. And these tendons are really visible in the elderly age. Why? Because we lose after the time subcutaneous tissue. And so to be better, the aesthetic of the dorsum of the hand, we need more tissue under the skin to cover tendons and veins. And so, for this reason, we arrive at the point. Why using dermal filler for the hands? And so, Matteo, this is a good point now we have some question about, in this moment for the dermal filler for using in the hands. What do you think, Matteo?
Yeah, thank you, Fabio. We will launch a small survey to all our audience, so we can have a little bit of feedback about our products. So we'll launch it right now. So please take your time to answer for the next 30 seconds this small question. Thank you very much. And we'll keep going with the presentation. Thank you, doctor, for this small and short interruption. Okay. 10 more seconds, a little bit more. Thank you all very, very much. And we'll keep going with your presentation. Thank you, doctor.
Okay, thank you, Matthew. And so now, why dermal filler for the hands? And so we know exactly hyaluronic acid for the face. It's 20 years that in the aesthetic medicine we use dermal filler, hyaluronic acid for the face with great results. And so it's a very good product that we can use and is very safe product. But now we have a different product because we have the product for dermal filler hyaluronic acid of Bioscience is different because we have a different composition. In the sense, is more the molecular weight is more heavy, is 250 Daltons, is more stable, remain more time, and so that is the perfect hyaluronic acid that we can use for the hand. And I need to pass Matteo. Matteo, do you hear me?
Yes.
Okay, I can pass the next slide. You know why?
Oh, can you press on your presentation? Press your your presentation button.
Okay.
Come back to your presentation. Okay.
Now, yes. And so why? Because we have a different weight now is in Hyalcorp Genefil. We have a specific hyaluronic acid for the body. It's different from the face, and so we can have a good result, safe result, and more stable in the time, and so can remain to arrive 15 months after the treatment. And what are the typical patients of treatment of dermal filler for the hands? Normally, is patients with elderly skin. The majority of the patient has age between 40 and 80 years old. And patients that had trauma or like deep burns or tumor resection that need tissue, and so volume, for any depression in the hands. And this procedure is really easy. Any doctor can do it in his office. It's very easy, but we need only to be clear some steps. And so we use a little anesthesia to be comfortable at the treatment during the infiltration. Normally, I use local anesthesia, carbocaine 2%, only in the point where enter. And I need a cannula that I use only for one time. And the dimension of cannula is, for my experience, for male hands, I prefer 16 gauge cannula. If 16 gauge is like 1.6 millimeter outer diameter. And for the male hands, I prefer 18 gauge cannula, is like 1.2 millimeter outer diameter. And now I describe the treatment, and if I don't know if all the colleagues are experienced in infiltration of the hands. And so my first suggestion is to put on the chair the patient with the hands on the table. It's more comfortable for you and for the patient. And so before to start any treatment, it is important to make a photo. I like to put something of black under the hand, that to be the contrast, and so to see exactly the difference between the before and after the treatment. And the light is behind of the patient, and so you can have the best photo, and you use always a camera with very high definition. And first of all, the photo. In this part, is important to talk with the patient only to understand exactly what is the point that doesn't like. The patient can talk. Normally, the first question of the patient is to cover the visible veins, superficial veins. But we have many depression on the dorsum that is between the extensor tendons. And so that is another point that we can discuss with the patient and we can treat. And so in this moment, after the photo, after the discussion with the patient, you can start to mark the area where we can make the infiltration. And because any hand has different defects, and so we can exactly mark the position of any depression how you like. And in this moment, after this moment, we arrive at the point of asepsia. And so it's really important to clean very well the dorsum of the hand. Normally I use medical soap before. That is really important. With the soap, clean the dorsum of the hands. Second, we use chlorhexidine on the dorsum to be sure, because this is very superficial treatment. But the rules of asepsia are really important. And so it's important that to clean very well, because infection is really rare, and we can have only this complication if you don't follow the rules of asepsia. So clean very well, pass chlorhexidine on the skin, and are you ready for the infiltration? The infiltration is an important step, because during the infiltration of hyaluronic acid, the patient practically doesn't feel anything. And so this is a short video that shows this exactly the point. I put like a little drop of infiltration. It's not so much. Only this is the point where enter with the cannula, and on the dorsum I take little points, like a little amount in different point of the dorsum. In this infiltration, is important that you don't break any veins, because you can see the veins are really visible. So don't put the needle in enter and that can enter in the vein. So you look very well. So it's important that be careful in this part, because doesn't happen anything, but it's important this step that you care a lot. And so we can start with the infiltration, and we can see the procedure is really simple and really fast. And so with the bisturi 11 or with the needle, you can break the skin and enter the camera. You arrive to the finger, and then you go back. When you go back, you release the wrong. And so again, you arrive to the finger, and you back and release the wrong. And so you go to the finger, and you go back. And so you repeat this process for 20 times around. You arrive to the base of the finger, and then you touch.
Sorry, doctor. Sorry to interrupt, doctor. Sorry to interrupt. That the two sounds are mixed. Your voice and the video sound. Can you please? Can you please turn off the videos? Yeah, so we can hear you.
Okay.
Yeah, that's better. So if you can repeat that explanation, because we had a sound issue. Thank you very much. No, it's okay.
Sorry for the sound. So we can see that we open with history number 11 or with a stink needle, and so enter the cannula. It's very easy, and you go very fast. It's very soft. You write to the finger, you come back. You go with the finger, you come back. When you come back, you release the hyaluronic acid. So that is really important. And you repeat these seconds for all the dorsal of the hands. And so in this step, it's not really important that it's important that you release the same amount. But in any case, if you release a little bit more at some point, it's not a problem. Because when you finish the implementation, you close the hand and you make a massage on the dorsum to be uniform all the hyaluronic cases under the skin. That is really important for the dorsum of the head because in this model you cover all the venous, superficial venous system and all the standards. And the hand appear immediately, right? And we can see immediately after the procedure that's the point of entrance, and we enter in many line with the cannula, only to be sure that you put the hyaluronic acid in the uniform on the dorsum of the hand. That is really important. But in any case, after the treatment, you close the hand and you make a massage to uniform all the hyaluronic acid on the dorsum. And so we see after the treatment, immediately the hand is not so bad, it's good in good condition, it's much better, it's younger, no more tendons alive. We see immediately after 24 hours. After 24 hours, we have a little erythema, a little bit red, maybe less, maybe light at the end, but that is normal. It's between start after 2 hours and remain for 10 hours or 20, but after 24 hours it goes away. And this is the photo after 90 days that we can see exactly that the amount of derma filler will remain a long time. And so the patient is really satisfied. And so I would like only to talk about my personal data that we have one number of patients that have treated 191, average of the patient 51 years old, youngest patient 53 years old, oldest patient 81 years old, female patient 171, and male patient 20. The time necessary for the procedure is like 10 minutes each hand, so it's really fast procedure that any doctor can do it in his office. Also complication, permanent and long-term complication, none. Temporary paresthesia in 17 patients, but resolved naturally after 1 day or maximum 2 days. Sometimes it's like after the anesthesia, maybe a little bit of paresthesia in the first hours. Temporary swelling of the hands in 33 patients. That is resolved in 2 or 3 days and can help, to be faster this edema. If a patient take a ball inside of the hand and go very strong, and so in these movements with the ball inside, they reduce the edema in the beginning, and so after 3 days they go away. Patient with follow-up period at least 12 months, 191. patient. And so we talk about the case. That is interesting point. And so we can see this patient is visible the veins and a little bit the extensor tendons. And after the treatment, we can see this photo after 2 months, how is maintained the position, and the dorsum is younger. And so that is really amazing. And so I have seen in my experience that the patient is so happy about the result that come back when finish the product every year, come back and is really happy to come back to you. The same patient, this patient, remember that as 50 years old, we can see the vein, the line, and immediately after, the result is really amazing. And so we have the hand appear, younger, because in the reality, in the dorsum of the hand, we lost tissue, subcutaneous tissue. And so we need hyaluronic acid to have the compensation of this loss. And immediately the hand appear younger. And we see another case. This patient is 77 years old. We can see that in old person immediately you have very good result, and the patient, this type of patient, they are really happy. We can see before and after. That is amazing. The result is very good and is very fast. And we can see that is a typical hand that normally arrives in your office. It's like a patient that is around 40 or 50 or 60 years old. This is a typical hand. And if you treat, you have immediately a wonderful result. And the patient are really happy, and so is in condition to say, okay, I like, and I come back. And is a different option because normally, not very usually, the medical aesthetic or plastic surgeon use hyaluronic acid for the hands, but in reality, it's really fast, really. The patient appear, that is very common. I think 90% of the person as practically as this type of hands. Matteo, are you hear me? Matteo?
Yes, here I am.
Okay. No, only I have the last slides. Okay. And
okay.
I showed this result. That is a typical hand that you have in that can arrive in your office. And so, if you arrive in this result, I guarantee that your patient remain for you for all the life. And so, for the next years, always come back. Are really happy. Very safe procedure. Very that you can do in your office. And very quick, and why not? And so I know that many aesthetic surgeon or aesthetic doctor or plastic surgeon don't treat a lot the hands, the dorsum of the hands. But I think that lose a big amount of patient, and with this product of bioscience, we are very safe product because we change it. This norm is not the hyaluronic acid that they use for the face. Is a product, specific product for the body, because it's different. The weight is more stable, and the molecular weight is 250 Daltons, and so more stable, remain more time, and so it's perfect for the purpose of the patient. Remain a long time, the effect in the patient, can come back after 1 year to do again the treatment. And so thank you very much for all the, now we talk with Matteo about any question about this infiltration. And so Matteo, what do you think?
Okay, thank you very much, Fabio. Thank you very much, Doctor. First of all, I would like to apologize because the sound was a little bit worse for a few minutes in the middle of the presentation. We're sorry for that and ask you to apologize. We have a lot of questions, Dr. Fantozzi. First of all, about the quantity of product you usually use for a hand.
Good question. And so, for male, normally for female is very the amount in female is around 10 ml each end, and so but could be possible a little bit less, maybe between 7 and 10 ml of product for each end, but depends of the how is big, you know, the hand, because there is some woman with a little hand or bigger hand. And so I think between 7 and 10 ml is the right amount. But if you have any, for example, if it's the first time that you use hyaluronic acid, you have maybe some you are not sure about the, your infiltration, about the amount, you can put, 7, and you wait maybe after 1 month. The other 3 you can put after 1 month. So it depends, how is your routine. But I think between 7 and 10 is for each end is the perfect amount.
Thank you, Doctor. We have a very interesting question from Ivan. Ivan asks, how does you bypass the dorsal veins so you don't cause any hematoma? Do you use a specific technique?
Yes, Ivan, that is a very, very good question. And so I explain why. And so it's important that you use a cannula of 16 or 18 gauge. Why? Because we have skin, and the skin we have the superficial veins, superficial system of veins. And so you, with this cannula, it's important that it's not too small, because too small you can break the venous. But with 18 or 16 is perfect, because it's a little bit bigger, and so it's impossible that you cut or you make any break in the vein. And with this type of cannula, and it's important that when you enter under the skin, you go superficial, not in deeper direction, but superficial direction to the finger. So like I show in the video. And so that's, in my experience, I never had any problem with veins. And so it's impossible with this cannula, in this direction of cannula, that you make any damage.
Okay, another question, Doctor. Thank you very much. One doctor is asking. He used radiase before, which is not a hyaluronic acid-based product. So how can you compare the results between injecting Iacorp or Genefil, hyaluronic acid fillers, and injecting a non-hyaluronic acid-based filler like radiase?
Okay, we enter in very interesting field. And so, which is the product, the best product that we can make infiltration for the hands? And so, we are sure that the hyaluronic acid is really safe. Why? Because the composition of the hyaluronic acid that we use it in the face, that is very sensitive area, for 20 years with very great result. Radiase is a wonderful product, but maybe could be possible that is a little more invasive, like composition, in the sense that I think for the best result, hyaluronic acid is more safe. And in my experience, I think that or hyaluronic acid or maybe lipofilling are very safe procedure. With the Radiesse is very good product, but I think like characteristic, I feel more comfortable with these two type of material. And I have not a big experience in Radiesse, but I worry a little bit in this case in the dorsum to use Radiesse for infiltration of the hands.
Okay, I have another question from Kostas Papayaoannou. It's very interesting. He said, do you combine that technique, the hyaluronic acid fillers, with superficial laser for pigmented lesion? And when?
Yes, I'm right. Papadopoulos is right. Yes, that is to be complete. You know, you complete the beauty of the dorsum of the hands, because if you remember my second slide is about the characteristic of elderly hand. And so we have many pigment, we have the skin, we have many problems with pigmentation. And so we can treat the volume with the hyaluronic acid, and so with the dermal filler. But to remove this pigmentation on the skin, you need a treatment laser or dermabrasion with chemical pills or with laser. That is very correct question, and you can combine, not at the same time. It's better to combine during the winter, because you know that when you make a resurfacing peeling with the chemical peeling or by laser, you need, not so much sun, and so you must be like vampire, and so it's much better to this treatment reserve during the winter.
Okay, we have another interesting question from Carlos Manuel Munoz. Considering 10 milliliter on each end, what's the duration expected on the filler?
Okay, the Hyalcorpogenic filler, as we are talking, that is not the normal hyaluronic acid that you use for the face. And so why? Because we have a different molecular weight. And so in the sense, when you use a filler, hyaluronic acid for the face, the weight, the molecular weight is around 100. Maximum 150, but this type of filler is a 250, the molecular weight, and so is more stable. If it is more stable, remain more time, and so the aggression from enzymatic aggression or other factor are more stable, and so can remain more time. And so these, because that is a filler for the body, and so can remain in a time that my experience is around 1 year or like 12 months or 18 months. Depends, the cases, depends the patient that is a smoker or about, other, characteristic, immunodepression. There are many factors that can remain a little bit more or less. But around 1 year is the time that remain this dermal filler in the hands.
And we have a lot of other questions about, is it possible to use the same face filler or any brand for hands?
No. Because we stay in the second generation of filler, because until now, in the last 20 years, and so the hyaluronic acid was only for the face, and so the practice was only for the face. This type of filler is for the body, and so we have different structure, is different product, is different everything. And so it's not a product that you can use for the face. For this reason, use it. We have a different use. And so now this type of product is for the body, but not for the face. Because if you use for the face, maybe you have any problem, it's contraindicated. You can have a reaction adverse, and so it's much better don't use. And so that is only for the body, not for the face.
We have another question from Eliana Saloum. She's asking if you inject in dorsal fingers. If yes, how? And if no, how will you treat aging on the fingers?
Okay, fingers. Fingers is different because fingers, I think that if you want, but only in rare case, you can make infiltration, but only in rare case, because in the finger is the diameter is not so much, is 1 centimeter, 2 centimeters. So is if you make a hyaluronic acid, you can produce a fat finger. So fat finger is not so beautiful, and so it's much better, a slim finger, but that fat finger. And so you can have, if in a rare case, if we can put a little bit, but I prefer, in my experience, don't use.
Okay, because we received a lot of questions about the type of fillers we're using. I just wanted to repeat that we have 2 different products in bioscience for hands, Genofil and Iacorp. But if because we have a lot of questions about this, if we use facial filler from another brand in the hand and it stayed only a few weeks, is that something you would recommend?
Sorry that I didn't hear. Can you repeat
Doctor
the question?
said he used facial filler from another brand in the hand, and it stayed only for a few weeks.
No, you can't use a facial filler for the hands. It's not possible because the problem that the molecular weight is really light, and so it's not correct that you use it for the body, for the hands, and so it's not possible.
Okay. One more question. We have a question from Natividad. She was asking if we always have to use cannulas to work with that kind of product.
In the reality, cannula use only one time. Is not the same cannula. And the diameter is 16 for the female, 18 gauge for the male, and but that you use only one time. And after, it's not possible to use a cannula that you can make a sterilization, and so it's much better use only one time and stop. And the cannula is important that the diameter is 16 or 18, not less, because we have the superficial vein system, and so it's important that you don't break any veins with the little cannula, because a little cannula can make a perforation like a bisturi, like a needle. And so for this reason is correct to use it for the dorsum of the hands, for the venous system preserve, to use 16 or 18 gauge cannula.
And a lot of questions are coming also about contraindication or reaction after the injection. So in case we inject like 10 milliliters per hands and you have a late reaction after 1 week, for example, it's a question by Fatih El-Sawi. If we have a reaction like an edema or a retained back, how do you manage that kind of issue?
Okay, is important. Okay, this type of hyaluronic acid, normally we have no strange reaction. The edema is normal, because the edema is like inflammation, because it's the trauma of the process. And so it's normal, because it's like when you take a punch in the face, you have edema. Why? Because the tissue, we have inflammation in so-called water, liquid. And so that's the edema, the reason of the edema. And so the edema, why you have? Because maybe the infiltration was so strong. Because you see my video, and so it's like enter like to cut the butter, and so it's very, very delicate. And so it's important that we do this technique of infiltration to be very gentle. Because if you are a little bit aggressive, too much, and so the type of infiltration is too traumatic, sure that you can have edema. This edema can remain a long time. And so it's important to be very gentle. And if you are really gentle in the filtration, you can have very little edema that remain very for 2-3 days, no maximum, stop. But if you want to treat with any product, the best is make exercise with the hands to close very strong the hands and massage a little bit on. And take some anti-inflammatory therapy for 1 week, and after you can resolve normally.
Okay, we have a couple of questions from doctors in Brazil about the availability of that products in their country. So I will answer that. We are about to launch IACorp in Brazil. So this product will be available very, very soon. Stay tuned to our social media and web pages, and we will inform you. But yes, we will be very soon in Brazil. Another question about bioscience brand, Dr. Fantozzi. Is IACorp and Genefil does IACorp and Genefil have the CE mark on hand and body augmentation?
Sorry, Matteo, that I didn't hear you.
Do you know if, okay, I will answer this question anyway, and I will ask you after that. Yes, we have a CE mark for all our brands and all products, and yes, we have a range of products for face, for hand and body. So, and we are CE marked on all these products. So it's completely available for all the brands and all the areas. One more question, doctor, and yes. I think it will be the last one. How are you sure that you are in the right plane? Is there any fixed points to be sure, like a demarcation point, so we know you're in the right plane on the end? Can you explain a little bit more about the anatomy of the injection?
Yes, look, and so we have under the skin, very superficial, and so it's important that when you make the infiltration to maintain the cannula in very under the skin, very extremely superficial plane that you can find. And so it's very easy because when you enter under the skin, you have only one plane, you have not other plane. And so you remain superficial. If you want to be sure, and so you take your cannula and you make the direction to the finger, but you go to high direction, not to deep direction. And so if you maintain this line, you stay in the right position. And so this is a very safe zone. You don't have any problem with nerves, arteries, with anything. And so it's very safe, but it's important to be extremely superficial. That because the dorsum, you stay under the skin of the dorsum and don't go inside in the deeper because you can find a problem.
Sorry, last question, doctor. We have a couple of questions from a dermatologist. Do a dermatologist can he or she learn and use that kind of product in the hand if he is a dermatologist in Europe?